The president is getting ready to update the American people about his administration's response to the coronavirus pandemic as the Omicron variant continues to drive a spike in infections. COVID-19 hospitalizations are up 33% in the last week, and deaths, they're up 40%. And today, the commander-in-chief will announce he's sending more federal medical teams to hospitals in need. Meanwhile, a lack of adequate testing resources is also causing problems for the nation's coronavirus response. Kris Van Cleave reports from a testing center in Washington.
Finding at-home tests like this still resembles a bit of a scavenger hunt in many places, even as states are ramping up testing capacity. Right now, nearly 3 million tests are being given a day. More than a quarter, more than 1 in 4 are coming back positive. Hospitals across the country are struggling to deal with the Omicron surge.
The sudden and steep rise in cases due to Omicron is resulting in unprecedented daily case counts, sickness, absenteeism, and strains on our healthcare system.
President Biden is now deploying military medical teams to support healthcare workers in overwhelmed emergency rooms in 6 states: New York, New Jersey, Ohio, Rhode Island, Michigan, and New Mexico.
Virtually everybody is going to wind up getting exposed and likely get infected.
The administration is also rolling out a new effort to improve testing at schools, sending 5 million rapid tests and another 5 million lab-based tests each month.
The president is clear. The nation's schools can and should be open.
Jessica Jodinez was getting tested at one of 6 recently added testing sites in San Antonio. She worries about bringing the virus home to her 1-year-old daughter.
It's very concerning because a lot of people just go with us and work and school, and I can't protect her from it.
San Antonio's University Hospital ER is already seeing dozens more patients a day than it was a month ago. Many people are showing up just looking for tests.
Stay home, talk to your primary care physician, see where you could go get tested within your community, and keep the emergency room available for true emergencies.
But don't come here for a test.
Absolutely not.
A senior administration official tells CBS News they expect around 575 million at-home kits to be available in the U.S. this month. And starting Saturday, private insurers will have to reimburse people for these at-home kits. Anne-Marie and Vlad?
All right, Kris, thank you very much. Let's bring in Dr. Michael Mina to talk more about COVID-19 testing. He's an epidemiologist and the chief science officer at eMed, a biotech software company that authenticates and reports home-based testing. Dr. Mina, there's been a lot of talk and even some confusion about the CDC's isolation guidance. You support requiring people to take a rapid antigen test in order to end their isolation. Explain why you feel that way.
Yeah, so we know that the dynamics of when people are infectious relative to their symptom onset has changed with Omicron. And so now 5 days, many people are actually still around their peak infectivity at 5 days. So some people will have cleared the virus. Some people will clear the virus days later. So one of the best tools that we have in our arsenal in this entire pandemic is knowledge of when we're infectious in real time. And so using one of these tests at day 5, before you choose to leave isolation, is one of the best uses of the tools to ensure that the people we know are infected are not going out and continuing to spread to others. And so it's a very powerful tool to limit that further spread.
So yesterday, the Biden administration announced that it was sending millions more COVID-19 tests to schools. I'm curious about how you think these tests should be distributed. I think it's really interesting. I have relatives in Canada, and they did something very similar in the school system where they are. They sent the tests home and allowed for everyone in the household to get tested. That's how my cousin realized that she had tested positive, and she kept herself and her kids home from school. But then you run out of tests very quickly when you do that. So what do you think is sort of the best way to use these tests?
Yeah, the tests have to be used strategically. Sending them out to sort of everyone, just one kit at a time, is not a particularly strategic approach, and it can dilute out the benefit of a testing program. So for schools, for example, some of the best uses are to identify who are the infected people using the tests, and that should be with some sort of frequent testing program. And then when you do find them, of course, there's quarantining the context of the kids. But also, we're really concerned about community spread, not just in the school, and household transmission is always one of the greatest places of transmission. And so we can use these tests for those homes, but we have to ensure that they're enough. We have to make sure that if we're going to support those programs, those tests need to be there in the household for people to use probably on multiple occasions, which is why it's so important that we continue to ramp up the accessibility and availability of these tests across the United States.
Dr. Mina, I don't know if you've seen this, but there's a new study out showing that the Abbott Binax Now rapid COVID-19 test showed about 95% sensitivity to the Omicron variant. I should note that it's not peer-reviewed yet, but the FDA said late last month that rapid antigen tests may not be as sensitive to the Omicron variant. First of all, can you explain to our audience and to us too, why a variant would be more or less sensitive in a test? I mean, presumably once you're infected with COVID, whether it's Delta or the original or Omicron or any variant, a test that is meant to test for COVID would pick it up, right?
Yeah, that's correct. Although what we usually are concerned about is if the virus mutates in a place where that test is normally grabbing onto that virus, then of course the virus might not be detectable. The difference with these rapid tests and many of the tests is that they bind and grab onto a place in the virus that is not mutating in Omicron. It's a pretty, what we call conserved region. It doesn't change a lot. And so we actually didn't have much reason to believe that these tests wouldn't work with Omicron. All the biology suggests that they would. And I think this new study of over 700 people out in California really demonstrates very, very well that these tests work just fine with Omicron. They're working very similarly to how they've performed with any of the previous variants to date.
That's really fascinating.
You know, when we talk about the coronavirus, we talk about the numbers, talk about COVID infection rates spiking. I think that with Omicron in particular, it becomes confusing to really sort of come to a conclusion about what that means. We know that people are being infected, but then we keep hearing that, you know, the symptoms are rather low and that, you know, people can test positive and they have an infection, but they don't even know they have an infection because they're not particularly sick. And so it's hard to determine what this means when we're talking about coming out of the pandemic. With the emergence of Omicron, do you feel like we're moving towards out of the pandemic stage and perhaps into what could be a new norm, or are we still should we still feel a heightened sense of urgency about this pandemic?
Yeah, well, the only off-ramp that the human race has with regard to this virus is not eliminating the virus. The virus is staying with us, period. What we have to now focus on is how do we build up enough immunity across the population so that the importance that the virus has to us as humans becomes less and less and less. In the same way that a baby will develop immunity to viruses and pathogens when they're 1, 2, and 3 years old, by the time they're 4 and 5 years old, those childhood illnesses are much less important to that kid than they were when they were 6 months or 1 year. We are all going through the same process as adults, which is a dangerous proposition because adults don't like to see viruses for the first time as adults, but we are getting there. So I don't think Omicron's the last variant to explode in the population. I think we have to stay very diligent about making sure that we have all the components in place so that what's happening right now with the lack of testing, with hospital shortages, that we don't see this again in the future. But we are getting there. These are.
Sorry, I'm sorry. Sorry, there was somebody in my ear, and I thought that you had finished speaking. Sorry, continue with your thought.
But we are getting there. We're seeing, you know, every time we get vaccinated, every time we get boosted, and unfortunately, you know, every time we get infected or exposed, the silver lining there is that we do build up another layer of immunity, and over time, it might be another year, it might be another 2 years. We have to see how much this virus continues to shift. We will get there, and we're on a road. We just have to have the right mitigation strategies in the meantime to make sure that society doesn't sort of collapse in our healthcare system.
So, Dr. Mina, I have a question. It's sort of a practical one. When we first became aware of the coronavirus in the early days of the pandemic, we were told that even if you were in proximity to somebody who had become infected with COVID-19, you should isolate at home for 14 days. Now, I wonder if the shorter isolation periods that have ranged from 5 days to 10 days, are because many people, 65% plus of Americans, have received their vaccines, and many more are boosted. And to people who might be worried that someone who was infected with COVID-19 and spent the next 5 days at home and doesn't have to test and shows up again at the office or shows up again at a restaurant, like, how concerned should we be that you might not still get it? I think in my mind, I don't want to be one of these people that, you know, sees a friend and they're like, oh, dude, I did what the CDC told me. It's been 5 days. I don't have to take a test. I'm clean. What up? And it's like, I don't know if I want to get that close to you. Should I be comfortable or should I be cautious?
No, I mean, the reality is people who are at their 5th day of isolation as a group are probably one of the highest risk groups for onward transmission. I certainly do not want to be sitting next to anyone who's been in isolation for 5 days and exits isolation and didn't test. They could be a super spreader right then. They could be at their peak virus load at 5 days. We don't know it, you know, and a lot of people are still at peak viral load at 5 days, meaning they're still shedding tons and tons of virus and can spread to others. This is why I think it's a very bad idea to not require a test at 5 days, because we know a lot of people will infect other people if they leave and go back to work and go back to school. And you know, the idea was to limit the amount of, to get people back to the workforce early. The problem is the pure math of it doesn't work out. If one person comes back a few days early and spreads the virus to 3 other people, yeah, that person might have saved an extra 3 days, but then has caused another 3 people to each collectively lose 15 days of total time from work or school. So this is a really bad idea, I think, and we should probably recommend as much as possible that an allocation of all the tests that are in the United States be used specifically to exit isolation at 5 days. And if you're still positive, don't exit isolation. You don't want to go on and infect the people around you at work and at school. It's a dangerous proposition when it comes to continued spread, you know, and ultimately vulnerable people are downstream and ultimately get infected when we allow transmission chains to keep moving on.
Dr. Michael, Mina, Vlad, I'm with both of you. I would feel more confident if I had a negative test after 5 days. I've said this before, that usually when you get sick, it's not sort of you're sick and then you're healthy. It's a clear, bright line. Often you're progressively getting better. And sometimes by day 5, it's hard to know if you're out of the woods. You may feel better, but that doesn't mean you're not sick. And I think a test is the way to go. But I understand tests are hard to find. Hopefully that will be changing soon. Dr. Mina, thank you very much.
Absolutely.